Busing.
Hello, hi. Can you hear me?
Yep. Yep, we can hear you.
Thank you. Okay, great. Thank you.
We can see your
All
tie.
right. All right. We've actually gone live already on Facebook.
Already, yeah? Okay.
Yeah.
Did you hear all my previous comments earlier? No, I didn't
No,
say
we did
anything
not.
I shouldn't say, yeah?
That's allowed. It would be great if you can tilt your camera slightly above so we can see your.
Cannot.
Oh, tak boleh.
Sit back a little bit like this. How's that look?
Yeah, much better.
Okay.
All right. Okay. It's already 1. So can we can we start?
I'm okay.
All right. Dr. Gary, you okay?
Yep, I'm good. Yep.
All right. Hi, everyone. And we are actually coming to you live with another interesting topic today. So this time around, we are going to discuss about fluttering heart. Why is my heart beating fast? So allow me to introduce to you our panel of cardiologists today. To me, they are the cardio bros, and they're a powerhouse here in Thomson Hospital, Kota Damansara. So first up, we have our consultant cardiologist, electrophysiologist and physician, Dr. Gary Lee. Hi, Dr. Gary. Next, we have Dr. Haizal Harun Kamar. He's the consultant cardiologist and physician. And last but not least, we have Dr. Lau Jin Choi, and he is also our cardiologist and physician here. All right, so if any one of you're feeling that your heart is beating fast and suddenly you are actually becoming overly aware of your heartbeat, then this is like the perfect topic to hear today. So leave your questions on the comment section below, and our cardiologist here will address them accordingly. I guess without further ado, we will just jump into the first question. Here is the very basic question, and I think I'll address it to Dr. Gary. Dr. Gary, so when my heart is beating fast, what does that mean? Perhaps you can elaborate more on atrial fibrillation and also some of the signs and symptoms to look out for.
Thank you very much, Mina. Thanks a lot. And it's nice to have my 2 very good brothers in cardio together with us for a chit chat today. And people used to have this kind of talk, but usually like one host and then there's one cardiologist. But now you have 3 cardiologists from Thomson Hospital to be with you this afternoon, to accompany you for your lunch, while you listen to us chit-chatting away, and hopefully you gain some insights into some of the health-related issues, especially with regards to our palpitations, or what we call heart rhythm problems. So actually, back to your questions, Mina, thanks a lot for posting that question. In fact, palpitation was symptoms that most people becomes a bit dumbfounded with, because sometimes when they come with chest discomfort, they find themselves breathing a bit fast enough, they tend to wonder whether it's this palpitation or not. And in fact, sometimes we do have to explain to them, how sort of differentiate between a palpitation, breathlessness, and of course chest discomfort, because sometimes all 3 of them can come at the same time. But basically, I like to simplify it as palpitation being 4 twos, meaning to say either you find your heart rate is too fast, too much means you have extra heartbeat, you find that, or you find that your heart is beating in a sense of too strong itself, a forceful contraction, or sometimes people do actually find that there's a bit of too long of a pause of a heartbeat. You find your heart skipping a bit. So to me, all of these 4 possibilities, whether is it too fast, too strong, too much, or too long, can be a possibility of pointing towards a palpitation. Now, what do you think, Haizal? Do you agree with me? This, or you have any other thoughts?
No, I totally agree with that. It's just a sensation of your heart beating or lack of beating sometimes, or it can either be fast, or it can either be slow, but the sensation of heart beating is just palpitation. Yeah, it can be normal, it can be abnormal, and I'm glad that I have my 2 brothers here to this is the only time I can have a chat, Mina. This is the only time I can chat with them, because they're just too busy. So thanks for having this forum.
Yeah. All right. So Dr. Haizal, so what are some of the common causes of say palpitation? I mean, does certain food or stress causes palpitation?
Well, I'm having one now, talking to you.
We have an
But
adorable host, right?
yeah, no, I mean, just having, being here, preparing for the talk, having a meeting, sometimes can give you a bit of palpitations like what I'm having now. That's quite normal. That is what we call physiological palpitation. Like when you go for an interview, go to sit for an exam, you feel your heart beating fast, beating strong. That is quite normal. I would say perhaps 90-95% of the time, that's quite normal. But in perhaps 5% of cases or around about that figure, it may point towards certain causes, okay, medical causes, such as perhaps there's an abnormality of your heart rhythm. It could be too fast. It could be a rhythm called atrial fibrillation, for instance. That's when your heart go at random, jumping haphazardly. Or it could be because of certain medical conditions such as hyperthyroidism, thyrotoxicosis, or due to certain other conditions, which I think either myself or the other cardiologists will be talking about later. So yes, it can be pointed towards a medical condition, but most of the time it is quite normal.
Yeah, and Dr. Haizal, just to follow up with that question, right? Like speaking of stress, how can someone actually differentiate between like a panic attack and maybe a heart attack? Because we actually received a question from Nadira, right?
Okay.
And her question is how to calm yourself down when you are feeling really anxious and you feel like your heart is about to burst and it's beating super fast. So I think a lot of times people might not be able to differentiate between those two conditions, right? So yeah, what are your thoughts on that?
Yeah, it's very interesting question, very interesting topic. You can talk an hour or two on this actually. Panic attack have some similarities, some symptoms with a heart attack. Okay, of course, there are many differences as well. In a panic attack, you have symptoms such as chest pain, breathlessness. In a way, the breathlessness is not so much breathlessness, it's more hyperventilation. You breathe fast, you can get tinglings in the hands, you can have aching in the neck, and a few other symptoms as well. Now, what happens in a panic attack? Usually there is a stressor or something that triggers the stress. And in a heart attack, that's because of a blockage to one of the arteries of your heart. I'll show you, this is a heart model, okay? We have the coronary arteries, the right, the front, and the back. Any one of these can get blocked in a heart attack. Now, a heart attack pain can be distinguished from panic attack pain, where panic attack pain is usually sharp, localized, whereas a heart attack pain, where the heart actually sits in the middle of the chest. Okay, most people think it's on the left. It's in the middle of the chest, pointing to the left. So you get the pain of a heart attack in the middle of the chest mainly, and or maybe slightly to the left, which radiates up to the neck and sometimes down to the left arm. Okay, associated with cold sweats, amongst other things. So yeah, there are some similarities between panic attack and heart attack. Now, if a person is young, for instance, and has lack of risk factors, by that I mean lack of hypertension, diabetes, high cholesterol, maybe doesn't smoke, then most likely the risk of getting a heart attack for that person is quite low. Whereas if that person has the symptoms, sorry, the conditions or the risk factors I mentioned earlier, then likely for that person to have maybe a heart attack. But if you're in doubt, see a doctor.
All right. So maybe I can throw this question to all three of you, right? Just to address Nadira's question again. So like when you're feeling really anxious, so how do one like usually calm themselves down? Because she's mentioning that sometimes her heart beats like super fast, and yeah. So maybe Dr. Lau, you want to address that?
Yeah, sure. Thank you for the question. I think panic attacks, it usually mimics whatever we are most afraid of. If you think that our panic attack is because we're having a stroke, then it mimics a stroke. You can get all the typical stroke symptoms. Again, the main thing is to understand that or realize that this could be a panic attack, and that is where it's most difficult. Yeah. So if you are having a symptom that you've never felt before, then and this is making you feel very worried, then the first thing I think you need to do is get it addressed by a doctor. It doesn't have to be a cardiologist. It can be your neighborhood GP, it can be emergency departments. But if it's something that you're afraid of and it happens, don't just think that this will go away on its own. Seek treatment, and then we can differentiate, or the doctor can differentiate whether what you're having is actually a panic attack, which again we will reassure you, and there will be different follow-ups that you will have to go for. But it could also mean something else, something sinister, like what Dr. Haizal pointed out. It could be a heart attack, and that is where I think the public should be very conscious about.
Yeah, all right. Thank you, Dr. Lau. For those who have just joined us, we are talking about fluttering hearts, or why is my heart beating fast? So if you have any question at all throughout this whole session, you can leave it down at the comment section below, and we will get our cardiologist to address it for you. All right, so Dr. Lau, when it comes to, say, heart palpitation, right, what medications are usually prescribed? And also, just to add another question to that, can herbal medication help to prevent heart palpitations too?
Okay, wow, that's a very good question. For cardiologists, when we hear palpitations and medications, if you're going to open our little ammunition locker per se, we've got tons and tons of medications. In fact, if we talk about specific arrhythmias, of course, I'm going into specific palpitations that comes from the heart and the heart causes. We've got 4 big groups of anti-arrhythmic drugs to say. It can range from our simple beta blocker that we give for a lot of patients, regardless of sometimes whether their palpitations could be heart related or not, to the big guns, that has got, of course, more side effects. So medications definitely will be a lot. Your second question is on herbal medications.
Yeah.
Okay. Short answer is probably not. In fact, if I were to think about herbal medications, I would probably think that they are probably one of the biggest cause of palpitations instead of preventing them. For example, a lot of herbal medications are meant to improve our blood circulation. They tend to stimulate, and they can stimulate our heart instead of helping to solve palpitations. So I've got patients who have been on, for example, herbal medications for knee pains, and in the end they contain a bit of steroids. And steroids are one of those things that most doctors are a little afraid of if you've taken non-prescription wise, because they have been known to cause, for example, atrial fibrillation, one of the most dangerous kind of heart rhythm abnormality that causes palpitations. A lot of times people take herbal medication for health reasons, not just for palpitations. If you take herbal medications, for example, for losing weight, for helping you sleep, it probably can help in terms of preventing palpitations on and off. But again, these things have to be very specific. We have to understand why we are taking that, and to what extent or how long do we take this. So yes and no in terms of herbal medications.
Okay.
In
All right,
fact, just to echo what Lau was saying just now, in fact, it is very true that a lot of times we have so many medication that we can use to treat palpitations. I'm sure any one of us have, prescribed lots of medication for that matter. And the last thing is, ever we want to prescribe something that is related to heart, all right, and the palpitation is related to heart, yet, we are given some sort of anxiolytic medication, something to reduce anxiety and reduce panic attack, then you will not solve the palpitation problem. It just makes you a bit tired, then you won't be able to function well. But rather, when you see a cardiologist and the palpitation really related to a heart, then when you are placed on a medication or prescribed a medication that treats the heart problem, then more often than not, you actually solve the palpitation issues at the root cause, rather than just reducing the symptoms per se.
Okay. All right. So, Dr. Gary, let's say a patient is certain that they have heart palpitations, right? So, how would a cardiologist actually evaluate and diagnose this condition? And is it like a scary process?
Yeah. In fact, I always like to tell them it's always a stepwise procedure. stepwise investigation, whereby, you know, we always go for preliminary in forms of investigation, which carries very extremely low possibility of any risk or adverse events. Then, but it gives us a wealth of information. For instance, if we do an ECG, the very remote chances you're going to trip on the ECG leads and fall down, but that's so it's so rare that you don't even report that. But rather, an ECG tells us a basic reading of the heart, whether there's any abnormality within it or not. Sometimes from the ECG itself, you know, out of 10 patients, probably 5 patients will be able to pick up some problems, and you sort of zoom in what's the possibility of the root cause. And of course, sometimes we also go a step further of doing an echocardiogram. It's basically an ultrasound imaging of the heart. It looks at the structure of the heart. So if you have a house, you get a civil engineer, you get an architect to look at your house structure. Now you're going to get a cardiologist to look at your heart structure and see whether it's sound, any valve problems, you know, any abnormalities within the structure itself. And then, you know, through these preliminary tests, we sometimes go a step further and do like stress tests, treadmill tests. Because sometimes on stress tests, instead of just picking up blood vessels, blockages, issues with the heart, we can sometimes induce abnormal heart rhythm that may allows us to strike a diagnosis of what is causing the palpitation itself. So these are usually the more so-called routine preliminary testing that doesn't cause any problems or any adverse events to the patient. Then, of course, through that, when we gather more information, then we go a bit more in detailed investigation like Holter monitoring. We will do something like electrophysiology studies. And of course, nowadays, we also have a lot of event recorders available in the markets. I'm sure my brothers here will talk about some of these so-called newer technologies that allows us to monitor heart rhythm, right?
Yeah. All right. So, Dr. Gary, we actually received a question from at the comment section, right? So, they want to know, when should I be worried about palpitations?
Yep. I think that's a very valid question. In fact, I always say there's 3 red flags of our palpitation. If someone just comes with palpitation alone, you know, probably we can always schedule to see them the next day or things like that. But if the palpitation always comes with 3 other symptoms, one is chest discomfort, second is giddiness or fainting spells, third is breathlessness, I would suggest you pop into Thomson Hospital to see one of us. You know, jokes aside, but I think you really need to see a doctor when you have any of these 3 coming along with palpitation, because it probably means something more sinister. What do you think, Lau and Haizal? Do you agree with me, or do you think you have something more that, you know, that add on to that?
Yeah,
those are the main 3 things to look out for.
Attack, you know, just like panic attacks, you know, if you're worried about something, and we're worried about stroke and it causes us to panic. So come by. Doesn't have to be me, it can be Gary, it can be Dr. Haizal, it can be any other doctor as well, but you should get seen if you're worried.
Yeah, even if you don't have the 3 symptoms that Dr. Gary mentioned, if it happens often enough, I think you should seek help.
Yeah, so as soon as you become overly aware, I guess that's when you have to, you know, take the next step to come and see a doctor. All right, so Dr. Haizal, moving on to our next question. This person would like to know, I smoke and vape, but I actually eat healthily, so my risk of heart disease is lower, right?
Well, it's good that you eat healthily, but smoking is a no-no. It has thousands and thousands of chemicals, I think about 4,000 plus, and all of them, well, most of them are harmful. If you don't get lung cancer, you might get heart disease, you might get stroke, you might get cancers of all sorts. And what smoking does, apart from coronary artery disease, I mentioned earlier about the cancers, and you can get lung disease, asthma, bronchitis. Now, vaping is perhaps a slightly safer form of nicotine inhalation. Now, it has nicotine, and nicotine itself is harmful. It can actually, it does vasoconstriction. It can it gets your arteries constricted and smaller, and it makes your heart work harder. As a result, it can raise your blood pressure, and in the long run, it can actually lead to heart complications. So yeah, the vape is probably slightly safer. It doesn't have maybe tar and other things, but it is also not a good thing. If you use vape simply to try to wean off tobacco, yes, that is quite all right, but give it a time, maybe 2 weeks, 3 weeks, 4 weeks, as a tool to actually stop smoking. But if you do that, if you do vaping as an alternative to smoking, it's a no-no as well.
All right.
Even if you eat healthily, even if you do exercises, if you still smoke and you vape endlessly, then yeah, you'll run the risk of getting heart disease.
Okay, thank you, Dr. Haizal. Okay, the next question I think is very relevant these days because most of us right now we move about with our smartwatches, right? And within those smartwatches, it's built in the ECG functions, and so the next question is, should I be monitoring my palpitations through my smartwatches, and how frequent should I be doing this, right? So Dr. Lau, you want to take on that question?
Okay. Yeah. So I think we are going into the realm of what we call over-the-counter gadgets. Yeah? I think before this, if we were to talk about 10 years ago, we will probably not even have an easy way of detecting our heart rates, for example. Yeah. So when we get palpitations, then we start to worry. We check our blood pressure, and the blood pressure machine would have a heart rate monitor. And then as technology advances, I think we're moving into smartwatches, as you pointed out. The one that comes to mind would be the Apple Watch or the Samsung Wear, then the Samsung Galaxy Watch. Yeah. So I think they've all have a little sensor in the watches itself that you will connect. You will put your finger at the point where the watch is, and it will kind of form a loop, and it will give you the kind of ECG tracing. And technology has advanced to the point where certain devices, other than watches, can give you what we call 6-lead ECG recordings. And again, these are very useful devices, no doubt about it. The only thing though is that for example, Apple Watch, I think the ECG app has not been approved for Malaysia. Correct me if I'm wrong, the public will probably know a little bit better. So for some reason or another, I think when it comes to medical devices, EKG or ECG monitoring is a medical device. It needs authority approval. And to then, last I heard was that, of course, a lot of Apple Watch users were really hoping that this app itself will be released. And there's hope that maybe the next couple of months of this year it will be released. And then people will really come out and show us, instead of coming to us with palpitations, they'll come to us with an ECG tracing showing their palpitation. And this is where I think it's important for diagnosis. Yeah. So a lot of times your palpitation is because your heart is beating fast, but it doesn't mean that it's beating at normal. So with these new gadgets, so I believe they've got some algorithm as well, and they can differentiate whether you're having what we call a sinus rhythm, a normal heart rhythm that is perfectly normal, even though you may be feeling palpitation because your heart is beating hard, or you can be having atrial fibrillation, so they can detect that. The caveat though with these devices are, I think, the accuracy. So we don't know how accurate these things are. As opposed to if you come to the hospital or a clinic and do a proper 12-lead ECG. So we've got all the little wires, yeah. So we've got the 12-lead that it will come up from the machine. Those are definitely, I would say, 99.9% accurate to diagnose your arrhythmia or your rhythm of the heart. When you've got a watch, probably I think we're looking at accuracy of about 80% from some reading that I've had before, and I've been following this for a few years. Yeah. So yes, useful definitely. And I think that once the apps from Apple or Samsung has been approved, and I think you'll see more patients coming to the clinic with the ECG tracing. That will really change some of our practice, the way we practice. Yeah, then we know, hey, look, I know your arrhythmia without doing an ECG for you.
Yeah.
What Lau said really makes a lot of sense, because nowadays the availability of such gadgets are quite worldwide. Everyone would definitely have a smartwatch or a smart band with them and things like that allows them to monitor. but we also need to know that these gadgets, the recordings accumulated from those, recorded from those, helps to complement what your doctors think about your conditions, how we come to a diagnosis and how we manage them. But to use it and then self-medicating, then that will be a big no-no actually. So it's always good, if you find something that is a bit worrying from the gadgets recording, it's always good to seek out with your doctors, your family doctors, to sort of sort it out whether is this really an abnormal rhythm that you've seen in your gadgets recording. I think that's very important. Whereas those who are under follow-up, with your doctors, and the doctors actually did prescribe you with some of these monitoring device to monitor your heart rhythm. For instance, we do have something here. This is a very tiny device where they can actually record their rhythms and things like that. I probably don't know whether you can see it here or not. Those are the things that then you probably would have to constantly communicate with your doctors and to show them the rhythms and things like that, so that they are well aware of your rhythm changes, the recording being made by the devices, so that they can then advise you properly. So it's always good, if you're already on a recorder, you already have these recordings, it's always good to seek a medical opinion for that.
And also, I think another caveat would be people who, again, rely on these gadgets to tell us, is it time for us to take medication? Should we take, for example, you have atrial fibrillation that comes on and off, and you think that I only take my medications when I get this atrial fibrillation. My blood thinners when I get atrial fibrillation, now that's a bit dangerous because that doesn't prevent the issue from coming in. And probably for some people, it's just like a blood pressure machine. When you buy a new machine, we are very excited to use it all the time. And later on, okay, it's normal. I use it less and use it less and use it less. So for niche people, there are niche patients where it will be very useful. So if they're under follow-up, they're monitoring, then I think these gadgets will be wonderful.
Yeah, I'm actually all for technology, and I think it's a very good thing. But it's just a caveat. But you have to be careful that this should only be used as a tool towards the management of the overall condition, and it's not an alternative to your medical consult. And a lot of my patients actually come in with all the gadgets and tools, and come in with a printout of graphs and all that, which is good. And I actually give them a pat on the back, and I say, look, this is good because you take ownership of your health. And to have this tool, it helps you to take ownership of your health as well, and be responsible for that. So yeah, go ahead, but that be a tool in the overall management and not an alternative, like what Dr. Gary just said, that it should not be without consulting your doctor.
Yeah. All right. Thank you so much for your thoughts, doctors. All right. Once again, for those who have just joined us, we are actually talking about why is your heart beating. So if you are experiencing like irregular heartbeats, or all of a sudden you're feeling that your heart is beating really, really fast, leave your questions down at the comment section below, and we will get our doctors to address it. All right, so the next question actually kind of comes from me because I've actually started running, and the end goal is maybe to like finish a half marathon or a full marathon. And now that I've said and put this out there, so I have to do it, right? But I guess the follow-up question that comes with that is, participation in high intensity like endurance activities such as marathons and also triathlons, can increase the risk of maybe sudden cardiac arrest, or maybe an increase, or maybe like even cause heart palpitations, right? Especially for those who are not accustomed to that level of exercise. Dr. Haizal, what are your thoughts on this?
Well, first of all, well done, Mina.
Thank you.
Maybe I should join you.
I'm trying.
Maybe I should join you actually. Right. First of all, exercise is good for the heart. I mean, it strengthens your heart. It's good for overall cardiovascular health. So yes. So everybody has to exercise. Now, the thing is, how much do you need to do and how much is too much? If a person like me, for instance, I rarely exercise, although I walk up down the stairs almost every day. If you embark on, say, a running, 5 kilometers, 10 kilometers, don't do 10 kilometers straight away. Do it gradually. But even before that, ask yourself, are you fit enough to do that? What is your medical history? If you have certain conditions that might predispose you to having a heart disease, no matter how old you are, especially if you're above the age of 30, some even earlier than that. If you have certain risk factors such as hypertension, diabetes, high cholesterol, if you smoke, and if you have family history of a heart disease, a premature heart disease, such as perhaps your parents, either one of them or both, having heart disease at the age of maybe 50s, 60s, then you should pay a visit to your nearest doctor and say, look, ask your doctor, look, do I have any of these conditions? I mean, am I fit enough to go for a hike, walk, run? And then, yes, then do that. The danger is if a person thinks that, okay, exercise is good, but then he goes on a 5 kilometer, 10 kilometer, do a marathon, do high intensity exercises without checking his or her health first, then he or she might run the risk of getting perhaps an event, a heart attack, and then complications from a heart attack. Then yes, I mean, whilst exercise is good, then you have to be careful to find to make sure that you know that you're safe enough to do that, and also embark on a journey of exercises and so on.
Yeah, because we actually just received a similar question in the comment section below. They said that can we exercise with heart palpitations? If yes, is there a limit? So I guess it comes back to your advice, to seek maybe medical advice from cardiologists to see whether it's feasible or not to actually run, right?
Yeah.
In fact,
yeah,
just to
exactly.
just to add on to that questions also, I think the worrying part is when someone is in a competitive sports and they're not well screened, they can of course lead to a abnormal heart rhythm and eventually lead to sudden cardiac arrest and in fact lead to a sudden cardiac death. So there's something very true. Of course, those who are having along the line going to be like Mina, going to go for marathon, full marathon and things like that. It's always good, to
I
make
hope I
sure
can
they
do
are
it.
well healthy, before you embark on something a bit more competitive. But if you're
Yeah.
leisure sort of exercises and all these, just a brisk walk on the park and things like that, that usually doesn't do much harm per se, Yeah, but it's when you're going to something like what Mina is going to be taking up, then that's something a bit worrying.
Just jog around the hospital.
So for all three of us, it's still good because you're still climbing up the stairs, so it's still okay, right?
Okay.
Yeah, we hear about stories about sports personalities, sportsmen, playing badminton, football. I mean, I'm sure that my colleagues Dr. Gary and Dr. Lau can elaborate later on as well. I mean, for heart disease in general, there are two groups of what called risk factors. One is the lifestyle risk factors I mentioned earlier, hypertension, diabetes, lack of exercise, obesity, high cholesterol. The other one is the genetic factors, okay, the family history. There is a condition that I think my other colleagues will also elaborate later. It's called a hypertrophic cardiomyopathy. Okay, it's an abnormal heart rhythm that can occur in a condition where the heart muscle wall is actually thickened. Let me just get you this model again. Okay, this is the heart. It's as big as this. It sits in the middle of your chest. Now, if you look at the heart model here, okay, you have 4 chambers. The 2 upper chambers, smaller ones, called the atrium, and the 2 larger ones called the ventricle. In between, there is a muscle called the interventricular septum. This can be thickened in a condition called hypertrophic cardiomyopathy, and that can lead to a dangerous and fatal heart rhythm, which may lead to sudden cardiac death. This is probably the most common cause of death, sudden cardiac death in young people, young athletes, such as in the age of 20, 22, and 25. Above the age of 30, 35, the most common cause of sudden cardiac death is still coronary artery disease. Okay, just for people to be aware of. So yes, if a person, an athlete, like Dr. Gary was just saying, if you involve in competitive sport, it's good to visit a doctor and just get a once over.
All right. Okay. Thank you, Dr. Haizal. All right. Next, I guess we will throw the question to Dr. Lau. It goes something like this. My dad had heart rhythm disorders. What are the chances of me getting it? Is this heart condition, can it be passed down from one generation to the other?
Short answer is, I think it depends. It depends on what causes your palpitation in the first place. Yeah. So if you've got one of these cardiac causes of palpitations, for example, atrial fibrillation, I think there's a lot of data, a lot of connection to hereditary. Yeah, you can get it. If you've got, for example, other lesser serious types, PVCs, ventricular ectopics, my extra beats. This is another very common cause of palpitations. Now, this is a little bit less clear. What I can say is that if you have it, if your father had it, and let's say your sibling had it, one of the siblings, then most likely it is hereditary. Yeah. But does not mean that if you've got a hereditary, that let's say your dad had it and your brother had it, that you definitely have it. It does not necessarily mean so. Just like if I like to eat burgers, my son does not necessarily have to like to eat burgers. There's a lot on the lifestyle that we do as we grow up, as we get older, that will determine whether we will get that or not, for example. Yeah, so depends. If you've got one of these non-cardiac causes of palpitations, for example, thyroid dysfunction, yes, there are those who are clearly hereditary. Again, there are those who are not clear. So don't worry so much if your dad had it or your mom had it. It doesn't necessarily mean you will have it.
Okay, all right. Thank you, Dr. Lau. All right, so we have been hearing more and more of, cardiac electrophysiologists and electrophysiology studies, and also ablation therapy. So what has this got to do with heart palpitation? Dr. Gary, you want to take on this question?
Oh, okay. Thanks, Mina, for asking that. So often than not, I think that was a bit of confusing terminology a lot of times for layperson, because I think heart attack being more prevalent type of heart attack, heart disease, that's why a lot of people tends to be a bit more aware of it. People heard of angiogram, people heard of angioplasty, ballooning and stenting. Because having said that, I think I'm sure my two other brothers will agree that we see a lot of heart attack even in the young people nowadays. It's no longer the disease of the 5th, 6th, and 7th decades anymore. But then again, nowadays we also see a lot of palpitations, patients who pop into our clinics coming with abnormal heart rhythms. And a lot of times, these young people, sometimes they are not in favor of taking medications. Sometimes medications are there to suppress the abnormal heart rhythm condition rather than potentially take away the problem. So that's where the origin of electrophysiology study and ablation comes in, because it's in some conditions, some abnormal heart rhythm condition, for instance, like what Dr. Lau mentioned, PVC. This is meaning having an excessive beat, an extra beat. And this kind of beats can be a bit disabling, especially if it comes very frequently, it comes in pairs, or it comes in continuous runs like that. So at times, most of these conditions, the PVCs that I happen to see are usually young groups of patients. They are at the 2nd, 3rd, and 4th decade of life. So these are the group of patients who does not want to be tied down with medication. That's why we offer them a form of procedure to potentially take away the problems. It's in terms of an electrophysiology study. So it's basically getting an electrician, checking the house electrical wirings. In this context, we're looking at the conduction system within the heart itself, and then find out where is the abnormal area, and we actually potentially burn away the abnormal area. So very much like you see a dermatologist, you have an unsightly scar, or you have an unsightly mole, you decide to go and laser it off, then it goes away, then you have a very nice looking fair skin complexion. And usually we go in by using wires that looks very tiny, like these forms of wires, to actually go within the heart chamber and find out where is the abnormal circuit and take it off once and for all. So usually the success are quite great if they come earlier on, before the heart structure damage sets in. Therefore, it offers them a potential cure in a way that they don't need to be on medication. But of course, it's not a procedure there without risk. So that's for your doctors or even your friendly cardiologists will be able to sort of advise you, the risk of between medication versus this kind of procedure. So take it as another form of treating heart rhythm abnormalities apart from medications. Yeah. All right. So I hope I answered that question.
Yeah, thanks, Dr. Gary. All right. So we have a question here. Coming back to the exercise issue, right? Simon one would like to know if the heart rate takes a longer time to return to resting heart rate after exercise. Is it an issue of physical fitness, or could it be a more sinister problem? All right, who wants to take on this? exercise one. All right, Doctor. Maybe Dr. Haizal, you wanna go with this?
Hi, Simon. How are you? Okay, right. It could be because of fitness issue. Yeah. For instance, if a person is not able to, has not been exercising, his resting heart rate is probably fast in the first place anyway. Normal heart rate is between 60 to 100. Anything above that is too fast. Anything below 60 is a bit slow, but it could be normal for athletes. Now, by that I mean, if a person is an athlete, is a marathon runner, his heart rate could be as low as 30 plus, 40 plus at rest. That means the heart is so efficient that it just pumps once and the blood goes everywhere in the body. Now, a person probably like me who's so not fit, my heart rate is probably going to be higher, much higher than 60, maybe 70, 80.
Yeah.
Now, likewise, if you a person who is not so fit exercises and it goes easily up to about 130, 140 after maybe just a kilometer walk, and when he rests or she rests, yes, it takes a while for the heart rate to come down. So for any athlete, for that matter, it's not just about the stamina or the actual ability to actually perform during the exercise or the sports or the performance. It is also the recovery time. This is what is important for athletes. How fast the person recovers determines how well he does for the next match and the next time he actually runs. So yes, it is partly fitness issue, but occasionally it could also point out to certain heart conditions. Maybe if you're not very sure, then perhaps best to see a doctor and do some tests like a stress test, a Holter, and so on.
So usually, what is the like the time like from you, like you're exercising, right? So usually how long will it take for someone to get their heartbeat back to normal rate or the resting rate?
We do stress tests regularly every day for our patients, and we try to get them to the maximum heart limit, and the maximum heart rate for a person is 220 minus the age, above which we feel that it is probably not useful or even be harmful if you go, because if you, this is a bit of physiology, the Starling's curve, if you, the higher the heart rate, the stronger the heart pumps, but after a certain level, the higher the heart rate, then the heart will not pump or will not work as efficiently. So, there is an arbitrary formula, which is what 220 minus your age. For instance, my age is now 25. So my maximum heart rate, yeah, you know what I mean. Yeah, so most people would actually do exercise up to about maybe 65, 75%, yeah, Dr. Lau, Dr. Gary, yeah, and maintain at that. And if you stop after about 5-10 minutes, it should get back down to almost your normal rate. This is what we normally observe in those going for stress tests, exercises. It will go down to between 5 to 10 minutes.
All right. So the time to look out for is maybe 5 to 10 minutes, and then it should go back down before someone gets.
In fact, if I can add on also, I think Simon should be more concerned if there is no heart rate variability. So this concept was always mentioned a lot of times. I think way back when we are just 1 year ago when we were still in medical school, right? But nevertheless, most of the time, if your heart rate doesn't go up during a stress test, you should be very worried. If the heart rate doesn't go up when you're doing exercise, you should be very worried. Then something is very wrong. But if you see a heart rate variety where it goes up and it can come down throughout the whole day itself, then more or less, you can sort of say, your heart may have been having a very healthy conduction system. That sort of puts you a bit at ease. But when it doesn't goes up, it doesn't goes down or whatever, then it probably non-existence of heart rate variability is the one you should be very concerned of.
If I can add, I think
sure, Dr. Lau.
What is usual for example, Simon, if your heart rate comes back down, usually within 5 minutes, and then suddenly you realize that it's taking longer than usual. Now that's a sign that something else is going on. Of course, if doing MCO, you've been resting a lot and haven't done much exercise, and then you start exercising again. Of course, that you tend to get a little bit. You tend to take a little bit longer before your heart rate comes down. But as you go along, you should be back to your normal time. And if you don't see that, then maybe it's a sign that you have to look look out for. Again, just seek advice if it's troubling you a lot.
All right, thank you, doctors. Okay, moving on to the next question. Is it safe to say, as a woman, I don't have much to be worried about because men are more prone to heart diseases? Dr. Haizal, what are your thoughts on this?
Right. Yeah, I get asked this a lot of times when I give talks to the public, and one of the things I post to the public is this: what's the most common cause of death in men? And a lot of the men will just shout women. So I'm just joking. Well, heart disease, okay? But when I ask the same question, what's the most common cause of death in women? And of course, the women say men. No, they will say breast cancer, cervical cancer, and so on. Now, actually, one of the most common causes of death in women is still heart disease. Okay, I'm not trying to downplay breast cancer, cervical cancer, ovarian cancer, or cancer pertaining to peculiar to women at all. It's just that it is not well. People are not well aware that heart disease affects women as well. In fact, in America, since 1984, more women than men die of heart disease every single year until now. So there are more women than men dying of heart disease in America, and it's down to lifestyle as well. I mean, we are following the Western sort of culture, and we're seeing more and more women. Now, why is it that the women are not many people know that actually heart disease affects women? Partly is because of the hormone that women actually have. Some of them is like estrogen. It protects the women from getting heart disease earlier than men. So once a woman reaches menopause, the risk of getting heart disease will be the same as men. So women will probably get it 10 or 15 years later. So for a man, get it at the age of 50, 55. Women probably get it at the age of 65, 70 years old. But yes, in fact, 1 out of 3 women will get heart disease at some point in their lives. 1 in 3. And perhaps 1 in 8 or 1 in 13, depending on which country, will get breast cancer. Again, I'm not trying to downplay breast cancer at all. It's just that because breast cancer affects mainly young women in those in working age, in high positions in society. So if they get breast cancer, they get more publicity in that sense. Whereas if you get heart disease at the age of 60, 65, they say, look, it's probably, you're old and you get heart disease. So yes, women and men, they get heart disease, and we should all be aware of this.
Okay. Yep. Thank you, Dr. Haizal. All right.
I think most patients who have got palpitations, at least who present to clinic with palpitations, are women. What do you think, Haizal, Gary?
Yeah, I agree. Yeah, mainly women. I wonder why though.
Is it because of the men?
Oops, it's always back to the man. But in fact, what Lau said was very true, because it's in fact there's this it's not a disease per se, but I'm sure Lau and Haizal will also echo the same thing, that we do see sometimes young ladies, especially, they comes with palpitation, and their heart rate is always hovering about 90, 100, but they're feeling very comfortable, and they're looking at you, but they keep on telling you that, when you're seated down, they felt very bad because the heart is palpitating away. So there's really this entity we call it inappropriate sinus tachycardia, which a lot of people in the back, olden days will say, you have anxiety, you have panic attack, you're young ladies, you tend to be stressed out, so it's okay, I give you some anxiolytics and things like that. But we do know that nowadays more and more case reports has come out and say that it is not anxiety, it's not mentally related, it's really an excessive physiological response from your heart conduction system, making the heartbeat going faster with minimal external factors. So it's really an entity called inappropriate sinus tachycardia, which deserve equally important attention by your doctors as well. So,
all right. So Dr. Gary, patients with heart palpitation, right? At some point, a pacemaker implantation is needed. So, at what point is that?
Yeah. Okay. Thanks for the very important. I often get asked that a lot also, because sometimes they come in and they see on my table there's this pacemaker models, and they say, do I need this? often than not, pacemakers are implanted usually for what we call slow heart rhythm. Meaning to say that, if they find their heart skip a bit too long, the heart has paused for quite a certain period of time, we find that the heart is not beating as it should at a normal rate. It's too slow. They get symptoms of giddiness, breathlessness, or even chest discomfort. Those are the constellation of symptoms that comes in. Then yes, they do need a pacemaker. And of course, a pacemaker has a lot of various types of we can implant on them. But there are also some cases of so-called palpitation, especially those related to patients with risk of sudden death because of so-called inheritable abnormal heart rhythm condition, like what Lau mentioned earlier, or even like some people have this long QT syndrome, which is genetically linked as well. That causes them to have very fast abnormal heart rhythm and they suddenly collapse and develop a cardiac arrest. Then we do put in a device, a heart device, an electronic device, but it's not called pacemaker. It's something bulkier. We call it an ICD. So an ICD is this big, a pacemaker is this small. So that's the difference. So the ICD is something we treat for fast heart rhythm in certain very selected cases. But most of the time when we talk about pacemaker that is this tiny, these are usually for slow heart rhythm. So there's a differentiation between a pacemaker and an ICD. And of course, not everyone who comes with palpitation needs this kind of electronic devices. Sometimes medication works. Sometimes you go for EP studies with ablations. Sometimes reassurance and things like that. So not everyone will end up needing an implantation. Right?
All right. Okay. So I guess we have time for maybe one more question. All right. It goes something like this: can a person with palpitation live a long and fulfilling normal life? Dr. Lau?
Oh, yes, for sure. Definitely. I certainly hope so.
Yeah.
Yes, most people with palpitations, aside from some, as Dr. Gary has pointed out, that has got a life-threatening consequences, most people with palpitations have got non-severe, non-significant issues. Yeah, of course, it's important to differentiate that. If you have got palpitations, let's say from atrial fibrillation, again, we're going back to atrial fibrillation because it's one of the commonest so-called dangerous heart rhythm. As long as you are treated, as long as you don't develop heart failure because you are treated well, you should live. Your life expectancy should be as normal as can be, and in fact, your life quality of life should be the same. Or you shouldn't affect your lifestyle. Yeah, one reason for treatment is basically so that we can give you the opportunity, or you can have the opportunity to do things that you want. Yeah. So short answer is yes, you will live long.
Okay.
In fact,
Dr.
can I
Gary?
just add,
Yeah.
if life,
Sure.
in fact, I always think, if life without palpitation is a meaningless life. Imagine you tell your partner that, you doesn't make me palpitate anymore. You probably won't be able to go back home today.
Yeah, that's great. I like that. Yeah. So any final words from you, Dr. Haizal?
Yeah, I mean, first of all, thank you all of you who are watching this, and I hope you've enjoyed this little chit chat between the three of us, and of course with you, Mina. You're such a great host.
Oh,
And
thank
thank
you.
you for and thank you for actually arranging this. We should have more actually. This is the only time I can meet my two busy brothers here, Gary and Lau. The other thing is take ownership of your health. This is very, very important. Yeah, we talked about the palpitations. It's just one symptom, but there are other symptoms of heart disease such as breathlessness, chest pain, dizziness, and so on. Okay, take ownership by first asking yourself, am I at risk of getting heart disease? See your nearest doctor as well. Okay, and this time of COVID-19. Take a jab. I had mine two days ago. It didn't hurt
nice.
at all. Yeah. It didn't hurt at
Nice.
all. Yeah, I'm the one who's so afraid of needles, and I survived. My arm's still there. So yeah. So anyway, take an ownership of your health. Best of luck, everybody, and stay healthy and stay safe.
And no side effect of palpitation, right? After the vaccination.
I had palpitations before the jab. After that, I was like, yay, Yeah. So
actually, we have questions coming in. We actually have questions coming in. Do you want to address them or? Yeah, do you have time? Yeah, I think we still have
think we
5
can-
more
we-
minutes.
yeah.
Yeah. All right. I think this question is pretty much the same like what we have discussed previously. Raiha is asking, I experience palpitation or skipping heartbeat whenever I'm anxious. How to make it go away? Raiha, we're actually going to post this video back on our Facebook. So feel free to check it out later because we have actually addressed this question. All right. Wong would like to know what is the difference between heart rate and pulse rate. Is there a difference? Dr. Gary, is there a difference between heart rate and pulse rate?
Well, technically, there's no difference in them, but a pulse rate basically talk about when your doctors put their fingers or their hands on the artery itself and feel the heart rate itself. We usually describe that as pulse rate. Whereas heart rate is something that you basically pick it out from the cardiac monitors and things like that. Or as a layman's term, we call it a heart rate itself. So basically, they mean the same thing. It still tells you about how fast your heart is beating and things like that. But a heart rate or a pulse rate within a normal range does not necessarily indicate a normal beating heart. Sometimes we have to look at the patterns as well.
Mhm.
That's why the ECGs, Holters, or things that your doctors usually do also plays a very important role in determining whether a normal heart rate is a normal beating heart or not.
Right. Yeah, once again, thank you so much for those who have send us your questions, and thank you for tuning in to our live session today. Don't forget to like this video, share this video, for the rest to see. And thank you so much to our, cardio bros. It was so good to have a chit chat with you guys. I can't believe 1 hour has passed by so quickly. All right. I guess with that, we will end our session.
Okay,
All right. Thank you so
Thanks a
much,
lot.
doctors.
Thank you. Thank you.
Oh,
Right.
wow.
Yep. Okay, we will end
Okay.
this. All right. Bye, guys.
Thank you. Thanks. Bye.